All right. I don't know if this interests some of you or not, but at 9:30, I'm meeting with Dr. Petrie, who's a physical therapist. He worked at Tri-City for a while with Dr. Nick Court, who I taught back in the day, and they're opening up a satellite branch of LSU Shreveport here in Lafayette. I don't know if y'all heard about that or not. So he's coming to meet with me at 9:30 to tell me more about it and kind of when they're going to be taking applicants. And so that's kind of cool. Having a satellite physical therapy place here in Lafayette. And I think it's like you would go to school here. It would be under the umbrella of LSU Shreveport, but they would have the cohorts here in Lafayette. So that's kind of so hopefully I'll have some more information for any of you guys that are interested. All right. Knee. Let's go to the knee. And I'm not going to do the videos first because I need to point out with the knee circle. So from 310, the knee is a modified hinge. If you guys remember how in anatomical position, the knee is screwed home, it's locked into place. But when you flex the knee, it allows a little bit of rotation. And that's so that when we cut and plant, we don't rip up our knee every time, just sometimes. So we have to give in some of this torsion when our knee is flexed. Right. Again, no different than a tree being able to sway and give so that it doesn't snap more, or a skyscraper bending and swaying. So our knee has some rotation when the knee is flexed. So if you notice these rotation arrows, knee internal rotators when the knee is flexed. Knee external rotator when the knee is flexed. So in essence, what you have is when your knee is locked into place and those collateral ligaments are taut and those condyles are locked into place, if your knee rotates when you're in anatomical, it's a bad day. It's not supposed to do that, okay? But when our knee is unlocked, then we can have some internal rotation and external rotation pulls, okay? So that's just important to know that these arrows are only when the knee is flexed. A lot of these you've seen before. Rectus femoris you've seen before, gracilis, sartorius, semimembranosus, semitendinosus. Now we're going to have our biceps femoris, but it's going to be both heads. Biceps, two heads. So we no longer have to say long head. We can say both heads, bicep, and then our calf gastron. So it shouldn't be too crazy. Now let's go to our PowerPoint. This is how our vasti, our uni-articular knee extensors, this is how they pull because they cross the knee anteriorly. Remember, I'm going to go into more detail, but this is our rectus that we had at the hip. That crosses the knee anteriorly, extension puller. This is a reminder of how it pulls at the hip. So it's a hip flexor, knee extensor. So again, if we were going to stretch this muscle, we really want to stretch it. We want to extend the hip, but flex the knee. That's when you really get that muscle to feel like it's about to rip out of the socket. All right. Biceps femoris, so we have the long head and we have the short head. What's really kind of neat is a lot of talk about it on the detail display videos. So that crosses the knee posterior. That's why it's going to have a flexion pull. The flexion puller. I love how it gives us different 3D views. There's our hip extension pull because it crosses the hip posterior. I think this is a good reminder too that flexion, extension has nothing to do with like global stuff. Like in other words, my elbow flexion pullers are going to be anterior, but my knee flexion pullers are going to be posterior. It's not all or nothing, right? It depends on what helps you get into fetal and what gets you out of fetal. Let's take a look at our So you see when the knee is flexed, you see how because that biceps femoris crosses laterally, it's like spinning a log. Be a lateral rotation puller. That's that big, well, for me it's not big, but that's that big string on the outside. It hooks onto the fibula head, but when your knee is flexed, it's going to be a lateral spin. Sartorius, so you guys know this one. Taylor's muscle, we talked about the hip already, but let's look at how it is a knee flexor because it crosses the knee posteriorly. Remember, this is one of those muscles that I emphasize why it's important to know function based off of how it crosses, because this muscle spends a majority of its life anterior, and it even inserts anterior, but it crosses the knee posterior, and so that's why it's a knee flexion pull. And I love the rotation pulls. Although this one doesn't show it as much, it's kind of showing the whole. So this one would be like this. My knee's flexed. Pull it like this. And that pes serene right here. Biceps femoris, sartorius, and those others. You're going to notice we have a lot of internal rotation pullers. And that's because when we cut and plant, if you remember from 310, we have external rotation of the knee when we do that. And remember, muscles don't just move, they protect, they stabilize. So having all those internal rotators medially can help prevent hyper external lateral rotation. So we got a lot of extra internal rotation pullers to try to help prevent hypermobility of that knee when it's compressed and forced. Sarcoidosis, knee flexor because it crosses the knee posteriorly in the back. This is just a reminder of its hip function that we had in the hip. And then when the knee is flexed, I wish that tibia would move more about the femur in this picture. I don't like how it's not moving, the tibia isn't moving relative to the femur. But can't always get it. All right, popliteus. Now remember guys, this is just showing you the videos of the pull because it was requested. When I go into the pictures, I'm going to get more details into these muscles, their specific extra functions, cool things. I love the popliteus. Popliteus is one of my favorite muscles. I think of pop-a-lock, you know, like you call them to unlock something. So the popliteus actually unlocks our knee when we're extended. Think of it like this: when our erector spinae, you have all these different muscles that help dissipate force so that we could stay erector and so that they don't get fatigued. But we can't have our quads on like all the time or they get fatigued. So when we're in an extended position and we're locked into place, that allows our bones to kind of rest on bone. Like we don't have to have like muscles holding these positions all day. So if this is locked into place, we need a locksmith to unlock it. So when we were kids, you ever went behind a friend and kicked him in the back of the leg and fall down? So that's how our popliteus, I'm going to explain how it works, but it's literally unlocks our knee. So that way we could start, utilizing our quads and stuff and go down. So it has the key to unlocking our knees and screw home mechanism. So, but it's a knee flexor because it crosses it. Oh gosh, we got music to this. Look at that. I'm sorry, I told you I liked it so much that it has some instance music. Like WWE. Let's see if this is maybe got back. I don't know where it is. Again, I wish that tibia would move around. Hey, there we go. That's what I'm talking about. All right, hamstrings. So semitendinosus crosses posterior, that's the hip flexion pull. You guys have already had the hip pull, extension puller, crosses the hip posterior, crosses the knee posterior. Again, I wish that tibia would give a little bit more motion relative to the femur. Membranosus. So they call these guys the hamstrings because back in the like medieval days, they would string pigs on those hamstrings because they were so strong. So they would just like string them and hook them on those hamstrings because I know it sounds. It gives me the frissons too. But that's what hamstrings come from. There's the hip pull. So activity would be a little bit more relative to the feet. Now here's going to be one of the cool ones. So we usually think about our gastroc, our calf muscles just doing ankle stuff, but it does cross the knee posterior. In fact, when you're talking about like the difference between seated calf raises and standing calf raises, is because on seated you take that gastroc and you put it on slack at the knee. You slack it, you shorten it at the knee, so it can't pull as efficiently at the ankle. So the gastroc medius is a knee flexor because it crosses the knee posteriorly. And it's a ankle joint plantar flexor because it crosses the ankle posterior. So you guys have all that PowerPoint you already have access to, so feel free to look at it when you can. If you're a lister, this is what you're gonna have to know. You have to know the muscles that cross and influence knee motion, and highlight the ones that have multi-articulation so that we know how to increase or decrease their contribution or optimize their stretch, right? So rectus femoris, that's a flexor knee extensor. Then you have our vast thigh group. No different than when we had like the adductor, brevis, longus, magnus, and imbricillatus. Vastus medialis, lateralis, intermedius, rectus. So the vast thighs are uni, and the rectus is bi. That's why it's a different name. Again, we're going to go through all the muscles individually, just giving you an outline of how the circle is going to work. So rectus, vastus medialis, intermedius, vastus lateralis. Those are vasti. What I love about them is that they're directionally named. Medialis more medial, lateralis more lateral, intermedius in the middle. The rectus is more superficial. So again, we talked about how muscles can serve as pulleys. So kind of over the top, they blend in into one common tendon called the quadriceps tendon before we get to the patella. So here you have your quad tendon. That's where the medialis, lateralis, intermedius, and rectus blend into one stretchy rubber band-like inert substance. That tendon passes through the patella. This is where there's some semantics difference. Some people will say this is the patella ligament because it goes from bone to bone, but it's not. It doesn't stop at the top and there's a different structure. It literally passes through the patella. The patella lives inside that one continuous tendon, if that makes sense. And so the tendon passes through the patella. Thank you for that classification of pulley that we get. I think that was a first class pulley where the bone is inside, it's encapsulated. And then it's going to cross the knee anterior and it's going to insert on this tibial tuberosity. Now what I want you to note is the line of pull for this quad is very much straight down. Straight. So what I mean by that is for the knee, there's going to be no like obliquity for any of these things. So in other words, even though the medialis is more medial, because it blends into a rope and that rope runs straight down, there's no like internal rotation pull of the medialis or an external rotation pull of the lateralis. They blend into one string, and after it passes through the patella, that one string just runs straight down. Does that make sense? So the rotation that we get from our knee when we extend or flex is just happening naturally with the screw home mechanism, the way the condyles are situated. The knee is naturally going to rotate into place because of the bone, in other words. So in other words, I don't have to have like my quad rotate my tibia in any way. So that muscle is just, that tendon is just passing straight down. So all it's going to have is an extension pull. So I'm explaining why in circle, all four of those quad muscles are on the anterior posterior axis. All they do is pull in the direction of extension. How would I, well, let me go through the muscles first. So let's go quads. So there's our big rectus, right, over the top. Hip flexor blends into that common tendon, the extensor, vastus lateralis, medialis, rectus. Now, some of you may say, well, why do these different vasti have obliquity if it's not for movement, stability? So your patella, Dr. Bob at Auburn said the patella is like a spoke on a wheel. And you need to, first of all, let me put this the right way. Your patella is like a train, and you need it to stay on the train track of your femoral condyle, okay? When you're relaxed, you can float that patella, no big deal. But when you flex that knee, that patella literally gets yoinked onto that, on the femoral groove right there. If the train doesn't stay on the track, it's going to dislocate medial or laterally, okay? And that's a bad day. So you want that patella to stay on that femoral groove. In fact, if you want to participate, if you put your hand on your knee and you flex and extend, if you get any kind of popping, grinding, right? That's not what you were born with. It's like any kind of popping and grinding is just literally the wearing away eventually of that surface, that hyaline cartilage of your patella. It's okay. We all have crackings and grindings and poppings. But the point is that when you utilize that quad, or especially when you have your knee flexed, the tendon above, the quad tendon, and the tendon below, the patella tendon, are literally yoinking that patella into that groove to make sure that it stays on the track. And one of the ways we try to help that patella stay on the track is to have obliquity of our lateralis and medialis to try to make sure that that patella stays in place. Okay. The medialis has more obliquity to it, more angle to it. So the lateralis doesn't, so it compensates by being a lot stronger. So your lateralis is actually a very powerful muscle of your quad. But those obliquity components, along with some ligamentous stuff, is there to try to help keep that patella on the femoral condyles, on the femoral groove while you're flexing and extending. Oh, here's a great view of how the rectus is on top of piggybacking over the top. I think we call that a fifth class pulley, that where a muscle can get a better angle pull because it's sitting on top. So there's our lateralis, there's our medialis, there's our intermedius, and over the top of it is the big rectus. Make a note of this, because sometimes students will miss this because they sound so similar. Quadricep femoris is 4 individual muscles, quad, but we have a muscle called quadratus femoris, which is one square-shaped lateral hip rotator. Do you remember that? So that can get confusing. The quadriceps femoris, 4 independent muscles that are part of like the group, and the quadratus femoris, quad, square-shaped muscle of the femur that's lateral. Don't get those two things confused. So, how could I increase the contribution of my vasti muscles as knee extensors? That's do an exercise when I need to recruit my extensors as agonists, but have my hips flexed. Because if my hips are flexed, that rectus is going to be more on slack. So that TheraBand is going to shorten proximally. And so those other vasti muscles are not affected by my hip position. So they're going to work more as the knee extensor group. If I want to increase my rectus more, I want to extend the hip. So maybe put myself in a prone position to work my knee extensors. If I want to stretch my vasti muscles, I do not want to extend my hip. Because if I extend my hip, then my rectus is getting extra stretch, and my rectus is going to be my limiting factor. I'm gonna run out of range of motion too soon because of how stretched my rectus is. So if I'm trying to stretch vasti, I need to put my rectus on slack and then flex my knee so that I can get further, I can get more flexion and thus stretch the uniarticular extensors. Does that make sense? So there are my knee extensors, crossing the knee anteriorly, rectus, vastus medialis, intermedius, lateralis. Quadriceps femoris. We got to take that rectus out so that we could see how it says vastus intermedius not visible? That's why sometimes we remove things that we can see or deep. There it's visible, but this one covers it. Okay, so again, here's our rectus, hip flexion puller, the extension puller. How many of you have ever had, or I guess it's mostly boys, but girls can have it too, knee pain, growing pains on the front part of your knees when you were kids? So that's when you're growing and you don't have good flexibility. You can have what we call apophysitis. You could have inflammation near a growth plate from those muscles yanking and tugging and irritating the growth plate that you have on that proximal tibia. And that's from your quad yanking and tugging on the tibial tuberosity. So where the quad is yanking right here, your growth plate is right there. So that's why some people like me, I actually had surgery on mine to remove it, but I still have a prominent little nub right there where it was actually pulling so much that my growth plate started growing laterally instead of longitudinally. Looked like it opened up your nose. All right, so we're good at rectus, we're good at vastus medialis. Again, crosses the knee in the front through that patella tendon, but why does it have obliqueness? To try to keep that patella tracking on that femoral stability. Lateralis, there's our intermedius down the middle. Our lateralis doesn't have as much obliquity, but it still has to help track, so it's a little stronger. It compensates with a little extra pull than the medialis. Has anybody ever heard of, maybe my athletic trainers have heard of this, Q angles in females? And Q just stands for quad, just the quad angle. hip differences and coming in on that femur. That's all Q stands for. It's just the angle of how the quadricep would come into the knee and then change direction and go down as it crosses the knee. All right, we've already had sartorius, hip flexor, knee flexor. Again, these what I this picture alone doesn't show the posterior crossing of the knee. I think it shows the anterior crossing of the hip, but not a very good posterior crossing. So that's why I like to add in other pictures. So look how the sartorius crosses the knee posteriorly. That's why it will be a knee flexion puller. I think this is also a great visual when I was talking about it being a talar muscle. In other words, if you spent an extra amount of time in this slackened position, it's like putting that muscle in a sling. And so tailors, sewers would spend, hours and hours and hours of time with that muscle in this slack position at the knee and the hip. And then when they would get up, it would be tight. And that's what their pelvic oblique would be. So does that make sense, guys? How it crosses in the front, in the back, crosses the knee in the back. That's why it's a knee flexion puller. Again, this little area, this pes anserine, that doesn't give you, you could say, all right, it starts at the anterior superior iliac spine, inserts at the pes anserine. That's awesome. What does it do? How does it pull? And that only gets answered by housing crosses. Crosses the hip in the front, flexion puller, crosses the knee in the back, knee flexion puller. So how would I lengthen it? If I wanted to stretch it optimally, I need to extend the hip, but I want to make sure my knee is extended. I don't want my knee to be flexed. It's going to put it on slack. So I need to make sure my knee is extended, then extend the hip, and that would optimize the stretch of the longest muscle in the body. Sartorius. So where does sartorius sit in your circle? Oh, we know it's a knee flexor. There's our sartorius. And then notice, so here's a right-sided knee. All of our appendicular circles are from the right side. And because it's a right-sided, this would be external rotation pull. This would be internal rotation pull. Make sense? Just like with the hip. Remember, all of these are when the knee is flexed. So for that sartorius, I love this picture because I think it illustrates that internal rotation. So this would be my right. So if you visualize it, I'm like this, and that muscle would be doing like this. It would be pulling in a direction of internal rotation. Internal rotation. Now, practically we see this, but in reality, where this really comes in handy is when I cut and plant, and I have all these hamstrings, these medial hamstrings, and these medial crossing muscles that are helping prevent hyper-external rotation, too much lateral rotation. These internal rotators are there to help prevent excessive lateral rotation. There's another good view of sartorius. Again, crossing the hip in the front, but crossing the knee in the back. I love this view. It's a good view of how it crosses the knee posterior. Y'all see what I'm saying? That like this view alone doesn't show me that it crosses the knee in the back. Does that make sense? Like I can't see a posterior cross in this picture, but I can see a posterior cross here, and I can see a posterior cross there. Yes. My favorite. All right, you guys, when your knee is extended or anatomical position, a lot of your knee flexors have very small moments, torques, rotaries of knee flexion. Like, in other words, they're mostly vertical. Should kind of make sense. Like when your knee is extended, most of the muscles that cross your leg have a vertical stabilizing component. Okay. The popliteus is unique because, and again, two-dimensional picture for a three-dimensional concept. So let's say this is our left leg. Notice how these condyles kind of jet out in a third dimension out at you. And remember, one of our pulleys is how the joint itself can serve as a pulley to help an angle pull. You remember that? I have to memorize the class, but remember how the joint itself, we gave the example in the book of how like one of our adductors can kind of wrap over the condyles themselves to help have a better angle pull. So it's very similar. The popliteus is literally using the depth of that lateral condyle to have a better angle of pull on our tibia. So in other words, when our knees are extended and we have all those other muscles that have more of a vertical, because of the pulley of that condyle, it has more depth to be a flexion puller when our knees are locked. That's why we call it the popliteus, like pop-a-lock, unlocking our knee when we're screwed home, when we're locked in position. No different, well, it is different, but again, someone kicks you in the back of your knee, it unlocks your knee. That's what this muscle does. This muscle literally contracts to unlock. Yes, it's a flexor, but once it unlocks you, then your extensors could take over to let you go down and keep you back up. If you had a perfectly balanced skeleton, it could stay extended. That's how efficient the screw home mechanism is. So in other words, you have to have something to kind of unlock you. Now gravity's trying to flex you. Now you're going to use your extensors to go down, your extensors to come up. But you got to have something first to unlock you so that way you can start having those extensors bring you down and come back up. Does that make a little bit of sense? Okay. So the popliteus is a knee flexor because it crosses in the back. It's another internal rotation puller when the knee is flexed. We'll get to there in a little bit, but right-sided knee. This is a left. This is a right. So check this out. This is how it runs. Using that condyle as leverage. When my knee is flexed, I want to do this. That's how it pulls rotationally when the knee is bent. When my knee is extended, it has depth that the others don't, and it can unlock. Lock. Now my quads and my hip extensors can let me go down, make me come up. When you squat with a lot of weight, we don't usually say lock your knees out, right? Kind of why? Lock your knees out, because then you'd have to unlock your knees. Popliteus. Unlock. I know what pop-a-lock is, huh? All right, sweet. Here's one we've heard before. Wait, I think I did the circle, right? Or if you had citizen circle. So popliteus, knee flexor, when the knee is flexed, internal rotator. Now, this is more for graduate school. When your knees are on the ground, there's going to be some lateral rotation of the femur that's happening there when you unlock. But I don't think we need to go into that for undergraduate. Gracilis. You guys remember gracilis, adduction puller, and a knee flexion puller. But again, this picture doesn't really show us posterior. It shows us medial lateral well. But to see the posterior, we got to have a different view. So there we go. A lateral view, a side to side, gives us a better view of how it crosses the knee in the back. If I want to stretch gracilis, make sure I have my knee extended, and it's an adductor at the hip, so I want to abduct with my knee extended if I'm trying to get that muscle stretched out. If I flex my knee, I'm going to slacken it. If I want to lessen its contribution as an agonist, I want to do my hip adductor agonist with my knees flexed. So I could just work those uniarticular adductor brevis longus magnus without as much help from gracilis. So let's see how gracilis fits. The flexor, and with the knee is bent, internal. I'm going to save your hamstrings and your gastroc for Monday, but we'll do a few practice questions. Practice some agonists and some contractions. I want to find, there's a very specific, there we go. This is what I want to find. This better. We try not to assume, right, guys? And so sometimes these machines, they look very leg extension-y, quad-y, but they can be very hamstringy, flexy, right? So it's all what the machine is trying to do to you. We don't want to say, well, this looks like a quad exercise. If we were working the quads, the padding would be trying to flex me. True. Well, this one, the padding is trying to extend me. Make sense? So because the padding is trying to extend me, I don't need extension pullers. I would need flexion pullers. Yeah, I would need the ones pulling down. So again, just an example. We don't want to look at that machine and say, oh, I've done that machine 1,000 times. Let's see what it's trying to do to you. Okay? So machine is trying to extend me. I need flexion pullers. Eventually we'll be able to identify those muscles in the group. You should have like 7 to account for. We haven't talked about your hamstrings. We haven't talked about your gastroc, but popliteus, psoas, sartorius. And then eventually we'll say, okay, how does our hip position affect our knee flexors? So eventually we can say where your hips are flexed, so that any hip flexor that's also a hip extensor would be able to pull a little bit more. Or any knee flexor that's a hip flexor is going to be on slack at the knee, and it's going to pull less. Right? It's like our sartorius would have less of a contribution in this exercise because our hips are put it on slack. Does that make sense? Now, those questions, when I ask them about the multi-articular muscles, aren't going to be open-ended. It's going to be like very specific. Like, would the sartorius have a greater contribution as a knee flexor or a less of a contributor or no effect? You know, it would be like that kind of stuff specific to a muscle. During this exercise, when we observe knee flexion, what type of contraction must have to have had during the flexion phase of this exercise? Concentric, absolutely. Positive work. Flexors do flexion through concentrics. And when I observe the extension phase, that has to be eccentric, right? So again, this is important, not just to identify or memorize the contractions, but apply them, because there's going to be times where we have to just do concentric phases or eccentric phases or heck, isometric phases. We got to know how to set those things up. So I want to show you that exercise compared to the traditional where they look the same. This is another curl. See, and designing equipment. So like you'd be working your knee flexors. So if someone says, well, what's the difference between doing seated and prone? Hip position. The hip position matters for multi-articular muscle. Oh gosh, I didn't even draw the right side, guys. Oh, please forgive me for writing this, but that's the only way they know it. So again, a very similar looking exercise. Look how similar. But working a whole different agonistic group. Does that make sense? Because the other machine, it was trying to extend my knees. This machine is trying to flex my knees. So I would need extensors. I would need extension pullers because the machine is trying to flex me. And then this class is like, okay, I know I need my extension pullers. Who are those muscles? Rectus, vastus inside, vastus outside, vastus in the middle, medialis, lateralis, and medius. And then hip position, right? My rectus is going to be a little bit more slack. Now, obviously, you can adjust. So the more you flex, the more slack you're going to put at that rectus. So if you seat more in a flexed position, you're just going to emphasize those vasti muscles more for that same amount of work. Think of it like this, guys. If you were doing 40 pounds resistance, if I lengthen my rectus and my rectus can contribute more, then something has to contribute less. That's still going to be doing 40 pounds. So if my rectus is like, dude, sweet, I could pull more because of my stretchy components within the vasti. I'm like, okay, well, I guess we won't recruit as much because you don't need. I'm not saying it turns off. I'm not saying your rectus is off. It's just its contribution is less because of the tension. Let's look at these kind of questions. Right, instead of that, let me see if I can do a couple of them, because it may take me a while to find specifically what I'm looking for. But if I were to do a stretch like this, could we identify which muscles of the quad would I be emphasizing or stretching more? So let's say I'm up against the wall and I do something like this. So we have 4 muscles of the quad. Which quad muscles would be getting stretched more than if I were to try to do something like this? You see the difference? So for this kind of stretch, my rectus is kind of my limiting factor. Right? It's really getting pulled at both ends. So I can't flex my knee as much when my rectus is my limiting factor. But if I slack my rectus, I can go back even further. My vasti muscles aren't affected by my hip position. So if I can flex more, then I'm actually stretching the vasti more than what they would have stretched if I'd have had my hip more extended. Does that make sense? And that's useful information. I remember, I was taught this when I was your age, but when I really felt it, I had a strain, had knee surgery and had a strain in one of my calf muscles. And one of my buddies, who's a physical therapist I work with at Southern Miss, she was like, well, let's see if it's your soleus or your gastroc. I'm like, let's do it. That sounds fun. And so what she did is we had my knee extended. She checked my range of motion. I didn't feel it. She unlocked my knee, put the gastroc on slack at my knee, then did a dorsiflexion test to see how much dorsiflexion, and then I felt it. She was like, oh, so it's cool. Oh Lord. Oh Lord. We got this cat. Well, we got several cats. You know, we take in one of them's big, and it's called Two Faces. And when he comes, he's just kind of wild, and we're like, oh Lord, he coming. That's what I felt like. Two Faces kind of trying to get up. It's so funny to watch him try to clean himself. It's like a baked potato. It's like, oh, daddy's big baked potato. So looking at something like this, um, so this stretch again would really hit rectus because you're not just positioning the hip in an extended position, but you have the knee. Now, I'm not saying you can't make it even more. Like you can imagine if somebody went and took her knee and flexed it more, like you'd feel it a lot more. Like that's cool. It's to show you that that muscle is affected by hip position and knee position. And so your hip flexor muscles, right, the other muscles that aren't affected by knee position, if you are trying to stretch, like say, like your psoas, your iliopsoas, you wouldn't want to flex your knee because then rectus would be the limiting factor, right? You'd want your knee to be extended so that that rectus is slacked at the knee, and then you might be able to get a little bit more hip extension to stretch the other hip flexors that aren't affected by knee position. That's how this stuff can be useful. Any questions so far? We should start to see a pattern of the kind of questions that I can ask for these, okay? So on Monday, we'll do our hamstrings. Obviously, the information's already there, but we'll do our hamstrings, we'll do our gastroc, and then we'll do some more practice. But the same kind of questions, just applied different parts of the body. Y'all have a good weekend.